AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher, guest today from Central District Health Department. Colette Evans is here to bring us up to date on some important stuff. Welcome back. Good to have you here.
It's good to be here. Thank you.
Breast Cancer Awareness Month. Let's talk about this because it affects everybody, literally everybody. Let's talk about what kind of an impact we are seeing these days.
Breast cancer is the second most common cancer among women in the United States. And in 2019, which is the latest year that they have the data available, 264,121 new cases of female breast cancer reported among women, and 42,280 women died of this cancer. So for every 100,000 women, 130 new female breast cancer cases are reported.
That is just a scary number. I mean, that's just popping up like crazy.
Yeah, it's a huge number. I do think that the October Breast Cancer Awareness Campaign has definitely raised awareness, has helped women know that they need to go in and get their exams every year. So the hope is that every year we'll see a little bit of a decline.
Well, awareness is good, but detection is what's most important. And like a lot of cancers, early detection is vital.
Absolutely. It's really the key to prevent death from having breast cancer. If it's found early, when it's small and hasn't spread, it's much easier to treat.
Is this something that's more age specific?
It is more age specific. Women between 40 and 44 have the option to start screening with a mammogram every year. I will say that there are definitely cases of women younger than 44, so we want everybody to be very vigilant. We want women to get mammograms every year. The CDC suggests that women 55 and older can switch to a mammogram every other year, but they can also continue to get those yearly screenings, especially if you have risk factors that contribute to getting breast cancer.
Is it still recommended to do self-checks?
Absolutely. We would love for women to do, and men actually, to do self-checks every month. Typically, we say a good reminder is like if you're in the shower, to do your self-check when you're in the shower. You're going to want to feel for lumps on your breast or lumps under your armpits and your lymph nodes.
We're talking with Colette Evans from Central District Health Department. It's Breast Cancer Awareness Month, so we're trying to get some extra information out about what this disease can do, but also things that you can do to try to help prevent it. Are there factors that pop up in people that you kind of say, well, that could be a pathway?
Absolutely. Excuse me, most breast cancers are found in women who are 50 and older, and there's risk factors that women have that they can't change, such as getting older, genetic mutations, reproductive history, having dense breasts, or a personal history of breast cancer or non-cancerous breast diseases, and then family history of breast cancer or ovarian cancer. There are risk factors that women and men can change, such as if you're not being physically active, you'll want to become physically active. If you're overweight or have obesity after menopause, you can take steps to address that. If you're taking hormones, reproductive history, first pregnancy after the age of 30, and drinking alcohol. Those are all things that you have control over.
These are important tips that can help you get on the path to being healthy again. What you need to do is to make sure that you visit with your healthcare provider. If you have questions, and also there are some support programs available too. Every Woman Matters, right?
That's correct. That's a federally funded program, and we see those filtering down through the Department of Health and Human Services, and there's criteria for qualification, but at the health department, if there's any questions about whether or not a woman qualifies for Every Woman Matters, we are very happy to talk them through that process and help them with the application process if they need that.
What number should they use to call?
Call us at 308-385-5175.
Colette Evans with some important tips. Breast Cancer Awareness Month is now. You can do your part to help keep you on the right path. Colette, always a pleasure.
Thank you.
Good morning from AM 1430 KRGI 105.5 FM.